Hi everyone, welcome to Camille's Holistic Health Show. I'm Dr. Cam. Today we're going to talk about osteoarthritis and back pain. And if this is a video that you are interested in, then go ahead and subscribe to my YouTube channel, hit that bell, and get notified every time I have a new video coming out. So let's begin. Osteoarthritis is defined as a medical term as dysfunction of the bones. It is the result of a drop in our self-sustaining chemicals, which promotes activity, causes the bones to reduce mass, okay, bone mass, and increase porosity. And it sets up for osteoarthritis, osteoporosis, and fractures and bone breaking of bones. So some of the etiology is usually includes hyperthyroidism, Cushing's disease, immobility, and it's obvious if you are not mobile enough. It can lead to lots of pain. And increase in phosphorus is another cause for back pain and osteoarthritis. And liver illness, lack of exercise, deficiency in calcium and proteins, and deficiencies in vitamin D, and bone marrow conditions. These are just some causes of bone osteoarthritis and back pain. So we're going to go now into some of the symptoms. We know it could be weight. Sometimes when you gain weight, that's a symptom for back pain. Joint pain, weakness is another symptom, and demonstrating some kind of walk, an unsteady walk. And kyphosis, that's another symptom as well. And let's get into some of the ways your doctor might manage osteoarthritis if you go to a regular conventional doctor. And alcohol, caffeine reduction, that's something they're going to tell you to eliminate. They're going to tell you to monitor. They're going to monitor you, monitor everything. They're going to help you with exercises and tolerating certain exercises, help you to supplement with certain minerals, vitamins like calcium, phosphorus. They're going to look at your lab studies. They're going to manage your hormones. If you're a woman, they're going to manage your estrogen, your estradiol, your estrase. Okay, you're going to see whether it's increased, decreased. And they're going to help you get on an exercise management or regimen way to help you eliminate your back pain. Okay, and simple ways to relieve it. And this is where a lot of people, 90% of people who suffer with chronic back pain, whether they be professionals, housewives, students, seldom use an exercise regimen. Okay? 10% have a condition due to an injury, such as a tear in the muscle, let's say. And if you have back pain, you're basically not alone. A lot of physicians diagnose back pain like they diagnose headache today. So it's very, very common, but know that it can be managed. Okay, we recognize back pain in two categories. That's acute and chronic. And acute is usually, it lasts for about 3 months if left untreated. And chronic back pain is that you are treated it has healed, and it falls in now another category, especially if it's after a longer period of time. Okay? So that's acute and chronic. And as long as you have no serious physical injury or occurring illness, back pain, chronic back pain relief is very achievable, like I had mentioned. It's all in the problem approach, how you approach it, how you identify it, okay? And how you are able to be compliant to whatever your therapist, whatever your doctor, your physician, your acupuncturist tells you. How are you going to manage it, manage your stress, manage all these things, all the way from your healthy lifestyle, because I always talk about that, incorporating a healthy lifestyle, a balanced lifestyle, to also be compliant to achieve this relief pain, okay? Because it's very achievable, but you have to be compliant. And going from the different types of ways, Tai Chi, yoga, there's mobilization today. I know my husband does mobilization. It's upcoming, it's within probably the last 5 to 7 years, mobilization has been really at the forefront. And I really recommend that, because it not only helps bending and stretching and really getting the joints in the back mobilized, but it also helps with circulation around those muscles that are stiff. So look into mobilization. It, to me, could be, I've never done it. It seems a little painful, but it's on a certain type of hard, round mat, and you leaned back and forward, and pressing, gently to harder and harder as you move this hard mat. So it's kind of like round, and I've seen my husband do it, and he says that he could swear by it. So definitely look into that mobilization. Okay. And then there is a TENS machine. It's often used in a chiropractor or chiropractic setting. It's often there, or a physician who does pain management. Seen it there as well. And my father we've owned one too. It is very mobile and handy and very light, and you can move it around. It's very cheap and affordable. It is really effective for chronic back pain, and it works with electrical nerve stimulation. So it helps by voltage, electrical voltage, to relieve this type of pain. So typically it's run by a battery operated device, and this device can be hooked up to a belt, okay? And then it has 2 electrodes, and you place the electrodes on the skin, and these are stimulating the nerves to close a gate mechanism. Don't really need to know that, but really it helps with the spinal cord, and it helps eliminate the sensation of pain, basically. And it creates a electrical impulse that travels along the nerve fiber and creates a tingling sensation. So the pain relief usually starts immediately, and it stops shortly after the treatment. Really good, really beneficial. I've used it before, and I really recommend it for long-standing pain. If you want to invest in that type of portable machine, I also consider that. So I always go to healthy lifestyle, because again, it's so important. It's not only about popping medications, though if you're on this video, I know that you're looking for alternatives to medicines in general. So herbs and homeopathic remedies and foods. Number one, to get you back to a better performing you. And this is what I love to talk about. This is what I do for a lot of my clients and homeopathic patients. So to begin with, always go back to whole foods when looking to reduce inflammation in the body. And I recommend salmon, sardines, black cod, tuna. They're very, very rich in omega-3 fatty acids, really help with an anti-inflammatory diet. And carrots is another. You can snack on this, you know, whether you want to have a salad or you can snack it on it, have baby carrots, and it really reduces a lot of the inflammation too. Don't forget those deep red, orange, green, purple color foods are really the ones that you want to zone in on and focus on and eat a large consumption of it. I mean, it's really will help with the compliance or the journey that you want to take to relieve the inflammation that's causing the back pain. Now, sweet potatoes, again, reduces inflammation. It is a superfood, means it's packed with nutrients, and it includes a lot of the inflammatory properties that are really beneficial. It can really be incorporated well as a side dish for lunch or dinner. Now, grapes, and some people drink wine, 1 glass or so. Red grapes also have the benefits of an anti-inflammatory diet and to cut down on the inflammation. You can eat a bunch of grapes daily and still be under the carb intake if that's what you are also considering and focusing on. Nuts and seeds. Again, I cannot stress the wonderful benefits of walnuts and pecans and all those nuts and sunflower seeds. Really, really great to add to your diet. And olive oil, I don't recommend vegetable oils, corn oil, safflower oil, sunflower oil. We recommend olive oil, avocado oil, right? Ghee. These are the foods or the oils that you want to cook with and pour over lots of the different types of foods that you're eating during the day. Green tea, I have talked about that previously in lots of my videos. You can go back and check. I've always mentioned the great benefits of green tea as an inflammatory part of your diet. And spices, basil, ginger, thyme, cinnamon, turmeric must be added into your diet as well. Essential oils could be added to your back pain. For your back pain or osteoarthritis, don't forget there's lavender, thyme, ginger, essential oils as well. So not only can you consume it, but you can also add it with a carrier oil, okay, to your and use it during the day for a bath. Whether you are coming out of the shower, you can add it onto the areas that you are having pain with, and use that, incorporate it This is a healthy lifestyle, remember, and you can do different things. Don't be afraid to venture into things that you might not have done previously to, reduce the inflammation, because this is something that is an ongoing process and it doesn't happen overnight. It takes time, and it is, again, something that has to be done each and every day. Okay, so foods to avoid: trans fats, unhealthy vegetable oils that I have just mentioned, high fructose corn syrup. You always want to add healthy honey or something a little more natural. Foods like saturated fats, no. Vegetable or margarine shortenings, no. And again, incorporating all of what I just mentioned can help you to get on a particular journey, because again, like I said, this is not an overnight fix. Alternative holistic medicine is not. It's a journey. It takes time, but you've got to work on your mindset in order to get on the journey and stay on that journey. Okay, so thank you so much for listening. Don't forget to comment below and I'll get back to you. And thank you so much for listening, and I'll talk to you next time in the next video. Bye.